Hello and welcome to the Pelvic Empowerment Movement. My name is Dr. Liliana, and today we're going to be talking about the difference between a pelvic floor physical therapist and a gynecologist. So let's start with me. So I'm Dr. Liliana. I'm a doctor of pelvic floor physical therapy. So any physical therapist that has gotten a clinical doctorate will have the letters DPT at the end of their name and may introduce themselves as Dr. such and such, doctor first or last name, whatever. But doctors of physical therapy are not physicians. We're not medical doctors, right? So we're not the person that, you'll go see and get, like your annual checkup from, unless your PT does wellness checkups. Like I can do a wellness pelvic checkup, but that's kind of beside the point. A doctor of physical therapy is not a medical doctor. We are trained in physical therapy, and physical therapy is essentially movement science, right? So we are trained to look at the body from a movement and functionality perspective. We are trained to notice how is the body moving and how can I optimize that movement via mobility, strength, length, like flexibility and coordination. So when it comes to the pelvic floor, right, so a doctor of physical therapy, when we're looking at the general type is like orthopedic, right? So that would be like, oh, I hurt my ankle, I need to go to PT, right? But a pelvic floor physical therapist is someone that focuses just on the pelvis and focuses on the pelvic floor, which is the group of muscles that live inside the pelvis. It's a group of muscles and they are bowl-shaped inside the pelvis. And we'll get into that in other episodes. There's so much to say about the pelvic floor. But a pelvic floor physical therapist is basically responsible for working with those specific muscles. And that involves looking at the muscles, the tissues, or like the connective tissues like fascia, the bones, the joints, the ligaments, all of it, right? And that includes like how you move, how your body kind of like navigates pain, if you have pain during sex or pain with your periods, and the strength of your pelvic floor. Your pelvic floor is just like any other muscle that, it absolutely needs the ability to contract with strength and also to have length, to be able to stretch fully, right? And it's a shame because so many anatomy, sex ed classes, like we're not taught this. And so that's part of my mission. We're going to talk about it. And like I said, other episodes, let me not get carried away. Today we're talking about PT versus gynecology. So a gynecologist is a medical doctor, someone who's done the entire medical training and then decided to specialize in gynecology and obstetrics. Usually when you go see your OB/GYN, obstetrics is the piece that looks at pregnancy, right? Birth, postpartum, that whole realm. And gynecology is the branch that focuses on the pelvic and reproductive organs. So that is really the main difference. A PT will focus on the muscles, on the bones, on the joints, while a gynecologist will look more to the organs. So now let's look at the differences and similarities between a pelvic floor physical therapist and a gynecologist based on our appointments, right? So like I said, we're both medical professionals. You go in, you make an appointment to work with either of these professionals, but the appointment vibe and the appointment sort of like what you can expect from the appointments are very different from one to the other, right? So let's start with pelvic floor PT. Because PTs are trained in the whole body, the whole system, and like I said, are specialists in movement science, a PT evaluation will include things outside of the pelvis. So that can include a walking assessment. It almost always will include a core assessment, a breathing assessment, strength assessment, things like that. It's going to give a more full picture look. Whereas a gynecological assessment, typically, you go in, you get changed, you sit, you put your feet in stirrups, and then you just wait for your pelvis to be checked, right? So as far as the scope, or sort of like I don't know what word, but basically pelvic floor PT, a pelvic floor may not only be looking at your pelvis, whereas a gynecologist, you could typically expect that they're going to go right in and really hone in on the pelvic tissues. Now, another difference, especially on this thread, is that typically your gynecology appointments are not going to be super long. They're usually, in some cases it's really sad. They're like 5 minutes or less, which is, advocate for longer time. You deserve to have more time. But typically, like, I don't know of too many gynecology appointments that go beyond, let's say, a half hour or 45 minutes at max, right? Your gynecologist, physicians are typically, they're run on a bit of a quicker schedule. They have a lot of patients to see in a day, which is, beautiful. We love that for them. Pelvic floor PTs, however, we typically see less patients in a day. So definitely your first visit, which is your eval visit. So you'll have your eval and then you'll have your treatments lined up after. Your eval, some places will even offer an hour and a half of just hands-on, one-on-one attention, and that includes history taking, assessment, treatment, things like that. Gynecology includes history taking, assessment, and sometimes treatment as well, but not always, and the manner that it happens is a little bit different. It's a little more streamlined. Whereas, like I said, PT, there's a little bit more of this, like, tell me your whole history. Let me look at your whole body. Let's connect all the dots, right? So a PT really wants to get that whole picture. And I want to be careful because it's not that gynecologists don't want to get the whole picture, but they are a specialty. They are zoned in. But see, again, like, I want to be careful about how I talk about this because we're a specialty too. But as far as gynecology goes, they're a little bit more of a streamlined specialty that works a little bit faster than PT does. You can definitely expect that you'll get a little bit more hands-on time with pelvic floor PT. Another major difference is that because pelvic floor physical therapists, are looking at the whole body, it's not always necessary to do an internal exam. Right? So when you go to the gynecologist, again, you typically expect that, you lay down, feet in stirrups, they insert a speculum, open the vaginal tissues, that way they can see the cervix, right? So remember, I said gynecologists are very focused on the organ system and the tissues. So your gynecologist wants to see your cervix, wants to, see if there's anything going on at your vaginal canal. Whereas a PT, we're more concerned about how are your muscles working? How is your pelvis functioning as a whole? So we also do an internal assessment, but we don't use speculums. We typically will go in with one gloved and lubricated finger, and we will, almost like a massage, because you can feel the pelvic muscles via the vaginal canal as well as the rectal canal. So we insert a finger and we feel around, and then we have you squeeze and relax your pelvic floor muscles and do our assessment that way. But like I said, because we're focusing on so many other areas as well, hip strength, core strength, balance, coordination, all these things, if you're not comfortable with an internal assessment, you can still see a pelvic floor therapist, and you should. You absolutely should. If you have any concerns about your pelvis and, beyond your gynecology visit, go see a pelvic floor therapist. You do not have to have an internal exam. And the last major difference I'll share is that gynecologists, will typically work with tests either like in-house, like they may have an ultrasound machine ready to go. They may have, any other in-house tests ready to go. And so that's what a gynecology treatment may include, right? So like a hands-on assessment and screening of your tissues, and or a medication prescription. That's the other type of treatment. Whereas pelvic floor PT, you can expect our treatments, we have ultrasound machines too, but they're not the same type. We use a different sort of ultrasound machine that's used to work with tissues, not to visualize on a screen. We have different machines, but they're both called ultrasound. It's kind of confusing. But anyway, we don't run tests typically in our offices. We can refer you to get other tests like x-rays, MRIs, things like that. We can refer that. But our treatment is exercise based. So we will run you through, maybe some stretches or maybe some strengthening exercises, some endurance exercises, things like that. So in an evaluation, we'll typically do some treat, and then we may send you home with an exercise program and probably a plan to follow up and continue the program. All right, so now that you know what to expect from each visit, let's talk about how you're going to pay for each visit. So both gynecologists and pelvic floor physical therapists have the capacity to accept insurance. So if you have insurance, maybe call your insurance company, see what they cover, see if they have any in-network providers or if they recommend any providers based on what your specific needs are. Now, the major difference here is that a lot of pelvic floor, maybe not a lot, but a significant amount of pelvic floor physical therapists are starting to move more towards a cash pay model, right? So if the practice doesn't accept insurance, they will likely be on a cash pay or cash only basis, which means you pay for the session upfront. Now, I don't know of too many like gynecology offices that are doing this. I'm sure there are some, but medical services do tend to be very expensive. So when they're not covered by insurance, so I'm not exactly sure. I don't have too much, like, I don't know a ton of offices that are doing just cash pay. I don't know any really, but I'm sure there are some. So keep that in mind. But typically your insurance covers it. You just have to find a practice that aligns with your insurance, because every practice can choose which insurance they do or don't take. Now, pelvic floor physical therapy, like I said, a lot of us are moving towards cash pay, cash only. My practice is strictly cash only, and mainly because, again, such a shame and such an injustice, I think, but a lot of insurance companies don't recognize pelvic floor physical therapy and don't see the value in it, especially when it's outside of certain diagnoses, right? So like if you were to, kind of like I mentioned in the beginning, if you wanted to get just like a yearly pelvic floor wellness checkup, insurance would kind of be like, well, you're not pregnant, you don't have a diagnosis, so this must not be medically necessary, and they won't pay the PT for the visit. So because a lot of PTs are struggling to get reimbursed by the insurance, they're just not accepting insurance anymore. And this is especially true for providers like myself who are like very holistic, you know? So a lot of times insurance will reimburse the provider, and this is true for any provider that works with insurance. A lot of times insurance will say you need to meet these requirements in order to get paid. So if I am a very holistic therapist and I am like, even like the example before of like, we're not going to do an internal exam. I'm just going to assess you from the outside. Maybe we're just going to do some manual work on your back, on your belly, you know, whatever it is. And I can't show or prove to insurance that we did any like, you know, X amount of time of therapeutic exercise or X amount of time of whatever, right? Like, you know, we won't get paid. And the pelvis being such a sensitive area, I really am so over that narrative, and I really think it should be up to the individual, the patient, and the provider to decide what they need in that visit, not the insurance like, well, you're not going to get paid if you don't do da-da-da-da. So for that reason, more and more pelvic floor PTs are cash only. And the reason I wanted to talk about this is because if you are looking for a pelvic floor physical therapist and you're getting frustrated because the sessions are expensive or they don't accept your insurance and you really want to go to this specific provider, I just wanted to provide some context and encourage you that the reason we're doing it is not because we're just trying to take your money. We're just trying to get paid for working in a way that we feel is most aligned and ethical. And a lot of times accepting insurance just isn't aligned with that because insurance isn't taking care of us and we want to be taking care of you. So just some context on that front. And I just want to end the video with some examples of when you would choose to see a gynecologist versus when you would choose to see a pelvic floor physical therapist. So I'm going to take you through two examples and we're going to see how the interplay works, because it's not one better than the other or one more important than the other. Absolutely not. PTs, we need our gynecologists. Gynecologists need PTs, and we need to be referring to each other, and you as the patient deserve to feel empowered and to advocate for yourself and asking, you know, can I have a referral to PT, or asking your PT, hey, do you think I should go see my gynecologist, right? So let's start with an example. Let's say you are experiencing significant pain, let's say in your lower abdomen, and you have no idea where the pain's coming from. You notice it gets worse when your bleed starts, but it's kind of inconsistent. You don't really know, right? So you're like, hey, I'm going to go see a pelvic floor physical therapist because this is in my pelvis and I don't know. Let's see what they say. You go in for your evaluation and your pelvic floor physical therapist says, okay. They do their internal assessment, they do their full body assessment, and they say, hey, you know what? Your muscles seem really strong. balance and coordination seems really good. Your movement seems awesome. So based on what I can tell, there's not a whole lot of evidence that could be pointing towards why you're having this consistent pain. Perhaps we could refer you to a gynecologist. And you go to the gynecologist does maybe an ultrasound or some other test and finds that you have, let's say, fibroids growing on your uterus or on your ovaries, and that's what's causing your pain. The gynecologist is equipped to diagnose that those symptoms and to help you treat those symptoms however you choose to, right? Now, a sort of inverse example, let's say you're having a lot of pain during sex. You go to the gynecologist does your exam and is like, well, there's nothing wrong with your tissues. We did an ultrasound. There's nothing wrong. There's nothing abnormal. Everything seems great. And then you say, okay, well, I still feel uncomfortable. Can you write me a script to PT? They give you a referral. You go pick a pelvic floor physical therapist that you like. You go in, and then your pelvic floor therapist can do the internal assessment, and they may find, oh, well, your tissues are really, really tight, and that's what's making penetration feel really difficult. And then you do a whole plan of care, and you find ways to loosen your muscles. You find mind-body connection activities to really relax your muscles at will, and sex isn't painful anymore. So bottom line, you see a pelvic floor physical therapist when your symptoms have to do with your muscles, your bones, your joints, your nerves, and you see a gynecologist when your symptoms have to do with your organs. Now, I know it can be a little hard to discern, is my experience rooted in, a PT issue or a gynecological issue. And I think the best thing you can do when you're not sure is go to your general physician first, let them know what's going on, and see what they say, right? They typically should be able to point you in the right direction, but the reality is that pelvic floor physical therapy is not always... physicians aren't always quick to refer to pelvic floor PT, and not because there's anything wrong with pelvic floor PT, but it is in a way still very new and up and coming. It is what it is. And even some gynecologists are hesitant, I wouldn't say hesitant, but it's not in their practice, it's not in their routine to recommend pelvic floor physical therapy. So if your general physician isn't recommending pelvic floor PT, you can always ask. And again, if you're not sure, go to the gynecologist first, get your tissues checked out, get your organs checked out, get all of that checked out first. And if it doesn't feel like you've gotten to the root cause, trust your intuition, trust your gut. If your body says that wasn't it, there's something more, advocate for yourself and say, hey, what do you think about pelvic floor PT? In my opinion, all gynecologists should always be referring to pelvic floor physical therapy because we explore this part of the body in a way that they don't. So we really are complements to each other. So if your gynecologist isn't recommending PT, ask. Always ask. And if they say no, whatever, go find a PT on your own. But a lot of times there's room for that conversation, and you deserve to have that conversation, and your body deserves to have care from all angles, like really all-encompassing care. Like you deserve that. So yeah, so ask your physician, ask your gynecologist, call a PT, whatever you gotta do. We're here to serve you. And like I said, all of the different medical professionals really are trained in assessing and treating something very unique. So it does benefit you to have a variety of providers on your team. So advocate for yourself, expand that team, get the care you deserve. All right, so that concludes this video. If you have any questions at all, feel free to leave a comment or reach out to me directly. I want you to feel empowered when it comes to choosing your care provider. But for now, that is all I have for you. Again, I'm Dr. Liliana. This is the Pelvic Empowerment Movement, and I am so excited to see you next time. Bye!